As people across the U.S. react to the Supreme Court's decision, there are growing questions about options for women in states that ban abortions. ABC 10 News reporter Madison Weil talked to an attorney about how the abortion pill could help women get around the law.
The discussion on abortion has changed.
Harry Nelson is a California-based attorney. He specializes in giving legal advice to telehealth providers. He says today, more than half of all abortions take place privately at home, with pills often prescribed virtually, sometimes even mailed to patients.
Specifically mifepristone and misoprostol, which are the two medications that are used up to 10 weeks in the pregnancy.
The question now is, will that be an option for women in states that ban abortion?
The general rule in America is that a patient is supposed to be treated in the state where they live, but we do have a lot of people who move around, who are traveling, who are in school.
In short, Nelson says there's a lot of ambiguity on this. While certain providers might not be able to prescribe patients across state lines, he says there will likely be loopholes, allowing anyone seeking a safe abortion pill to have one mailed to them.
I think it's going to be impossible for these hostile states to actually prevent people from prescribing or from just mailing the medication in.
Nelson says there are already several advocacy organizations that would allow a woman to put her address as a place in, say, California, and then mail the abortion pill in a discreet envelope to her.
The real question is, how many women are aware of these options?
As some U.S. states move forward with these bans, Nelson says education will be critical, so anyone seeking abortion medication can do so safely and from a reliable provider. Madison Weil, ABC 10 News.